Welcome to Health Matters. I'm John Nolan, physician assistant, and my office is at Health Force in Dunlap, Tennessee. It's summertime, and today I want to talk to you about insect bites and other critter bites. Obviously, this time of year we have to deal with these insects that love to make our life miserable, and how you deal with that particular incident or the bite is what I want to talk to you about today. Now, most insect bites are very minor, such as the occasional mosquito bite, and generally most of us know how to take care of that. There's a lot of home remedies, but one of the best things is to clean the area well with soap and water and apply an over-the-counter cortisone cream. Usually this will stop the itch. One of the worst things you can do with an insect bite, such as a mosquito bite, is to scratch it. So I want to talk about some of the more serious type bites, and the one that comes to mind every year is spider bites. I think here in the South we have a lot of folks worried about spider bites, and I see a lot of folks in the office who are concerned that a spot on their leg might be a spider bite. And in reality, most spiders do not bite us unless we challenge them. The most dangerous one is our brown recluse spider, so called because it likes to hide in dark areas such as our shoes. And the typical scenario is a person puts his foot in a shoe, it startles the spider, and either bites him on the foot or it can move up the leg and bite somewhere on the lower leg. One of the first things you should always do during the summer is shake your shoes out before you put them on. If you were to be bitten by a spider such as a brown recluse, the reaction can be extremely severe. The spider injects a chemical into the skin that creates a breakdown of the tissue in order for the spider to get its nutrients out of your skin. This in turn causes fairly instant cell death in your skin, and it can create a large ulcer. So any suspected bite that continues to give you problems, particularly pain, after 24 hours should be checked by a medical professional. Tick bites are another concern this time of year. Again, I would say probably 99% of tick bites are benign. We have small ticks here in the area called seed ticks that are easily removed. The best way to remove a tick is to flip it over on its back and pull it gently. That way you'll retrieve the head. The deer tick, though, is one that is a bigger concern. It does have the ability to transmit Rocky Mountain spotted fever. These are much larger than the seed ticks. Again, not a big deal. If you see one on you, just flip it on its back and gently pull. They also make these little picks that you can slip under the tick and pull it out without a big problem. One of the main symptoms of Rocky Mountain spotted fever is fever. And generally that's what you start with, is a very high fever somewhere between 7 and 10 days after the tick was found on your skin. This is followed within 2 to 3 days of a rash that starts on your hands and feet and migrates upward. It's a bright red, flat, not particularly itchy rash. So anytime you see an onset of fever after a tick bite within 7 to 10 days of a bite, or if you see a rash that starts on your hands and feet and migrates upward, that could be a cause of concern, and you need to check with the health care provider. The last bite to be concerned about, in my opinion, is a snake bite. Again, extremely rare. Snakes would rather not come into contact with us, and they will avoid us whenever possible. Most snake bites of non-poisonous nature are benign and do not cause any lasting harm. Our 3 big snakes in the South are the rattlesnake and the copperhead and the water moccasin. If you have been bitten by one of these snakes, you need to seek medical attention immediately. Do not try to catch the snake and bring it with you. All you have to do is describe it to your healthcare provider, and they'll be able to treat it the best way that they know how. So in conclusion, most folks get through the summer just fine without any problems from insect bites. But any bite that continues to give you a problem beyond 48 hours should prompt you to seek medical care. This is John Nolan, and this is Health Matters.